Okay, good morning, everybody. Okay, if we could have people take a seat, if there is a seat. If not, you have to stand. Okay. First of all, welcome. Thank you all for being here. This is our fifth Gun Violence Forum. And I'm Mike Dowling, and I'm the president and the CEO of Northwell Health. So I want to welcome all of you here in person. I also want to welcome the over 2,500 people that are watching virtually. So we have a very, very, very large audience, which is important and appropriate, given the nature of what it is we have to be talking about and will talk about. To begin with, before I forget, let me say a special thanks to the staff who put all of this together, and to Landmark, the company that we work with. People like Alison Rosenfeld down here in the back, and a lot of other staff that makes something like this happen. And I also suggest that each of us now think about the staff in each of our organizations who are back in your businesses doing yeoman's work on issues like this all the time. Those of us in leadership responsibility get a chance to come to meetings like this, but we can't forget that it is the people behind us and working with us that do so much phenomenal work. And they deserve an ongoing credit and commendations for their commitment, their passion, and their dedication to a topic like this. And today is an opportunity, as it is always when you have meetings like this, to get to know one another, to make new friends, to connect personally with people that you may be in contact with virtually, but don't necessarily get an opportunity all the time to meet in person. And meeting in person is very, very important because it bonds relationships. And today is an opportunity to share insights, share information, learn from one another, strengthen our resolve. We're working on an extraordinarily positive course. What we're working on, in many ways, creates the essence of the communities that we want to live in going forward. It's about what kind of a society do we want? What do we want to leave behind? What do we tell our kids, our grandkids? What do we mean by the concept of community? That's what today is. We are change agents in the process of improving society for the betterment of everybody. And those of us in the healthcare field have, in my view, a special obligation, because gun violence is a public health issue. You know, and I recall back 5 or 6 years ago when I got very much involved in this, and so did Northwell. And many of you in the room have been involved for many, many years prior. But I remember when we started back then, there was a lot of skepticism. Why are you getting involved as a CEO of healthcare in this issue? We don't necessarily believe. People told me that it's a public health issue. People said it's a lane too far. It's not what you should be involved in. Stay in your lane. Don't go outside your lane. There was worry and fear among people. I remember calling many people across the country, CEOs of healthcare organizations, many of whom I've known and respect, and asked them to get involved, and they were fearful, nervous. This is too big an issue. It's too complex. It's too politically complex. My board won't like it. You don't understand my community. But, you know, you have to be optimistic. Things always change. And optimism is very, very possible and important, being positive. So since that time, and if you look back over the last 5 or 6 years, there's been a surge of activity across the United States. Organizations doing things today that they did not do before. So many of those entities that suggested back then that we shouldn't be involved are now directly involved. There's been a lot more collaboration, people working together more so than ever before. There's been more activity by hospitals and health systems. The argument now about whether or not it's a public health issue, that's no longer the issue. Everybody now says it's a public health issue. This is what we should be about. We see actions at the state levels. Recently, there was a report about dozens of hospitals and facilities in Philadelphia coming together as a collaboration to work on gun safety prevention. That didn't happen before. So there's good news. I think we're in a better place. I think we've made progress. Small, maybe to some extent, some people minuscule, but positive change, no matter how small, is always important. That's how change occurs. Incremental piece by incremental piece. Look back over the history of most major issues that have been accomplished. It's not one big effort, initiative at one time. It's all the small things. So there's been progress. New York State created an Office of Gun Violence Prevention and Safety. We have Rob here from the White House, where there is a new Office of Gun Violence Safety and Prevention. Didn't exist before. There's been legislation. You know, the Safer Communities Act, one of the largest, most comprehensive piece of legislation that's been passed in a long time. Bipartisan. It was passed. You're all familiar with it. Positive news. Because when you're on an effort like this, and the journey is long, and the goal seems far off, it is very important to recognize that along the way we're making some positive change. That's how you inspire others to get involved. It's not a lost cause. We don't succumb to defeatism. We promote positiveness. Now, we obviously have a big issue. But even on the numbers, and this will be commented on by Chris Murphy in a little bit, who has been a phenomenal advocate, as you all know, on this issue for many, many, many years. But there has been a decline in firearm injuries and death over the last number of years. The numbers have improved somewhat. Not necessarily with regard to adolescents, not necessarily with regard to suicide, but overall, there's been a small decline. And that's positive. It doesn't mean we take a victory lap, but there is a minuscule bending of the curve as a result of the enormous collaborative activity by all of us over the last decade and less. Important. But we got to stay focused. We've got to stay committed. I often recall when I talk to people about this, about the effort years and years ago to deal with automobile accidents and deaths. The advocacy by people like Ralph Nader, who at one time, years and years and years ago, and there's many people in the room here that probably don't remember, when they talked about seat belts and safety bags. And everybody said, impossible, can't be done. The car manufacturers will never build cars with those. The public will never buy cars with those in them. It's too big a cultural shift and change. Yet look at it today. And it's very interesting if you do go back and you do look at all of the individual initiatives that led to where we are today with regard to automobile accidents. There's a common element between that and what we're doing today on gun violence. So what we all have to do is look ahead. Look out over the horizon and sit and believe someday we will get there, where we don't have to have meetings like this about the need to continue to do what we're currently doing. That we will have made continuing progress and get to a better place. So it's always inevitable in some regards that people get depressed. They get frustrated. They get tired. The issue seems unsolvable. Not the case. Because of everything that everybody here has done, we've made some positive change. There are more people involved today. There are more people recognizing the fact that this is a society that should never be able to use the statistic that guns are the leading cause of death for kids. There are more and more people who believe that gun safety and prevention is an important priority. There are more and more elements of legislation being discussed in every state in the union. So it's important to be optimistic, because this issue affects us all. I mentioned this last night at another event. We're all victims. We all worry about our security when we're out in public. Maybe a little bit, maybe some more. We worry about our freedoms. Where can we go? Where are our kids when our kids are out? When you're in a large group, you worry a little bit because you've seen what has happened and you wonder, is it going to happen here? It affects our sense of community. It affects all of us, how we think. It limits our freedoms. It limits our sense of security. We are all victims in one way or another. Many people, and many of you in the room, have had unbelievable personal tragedies. But this is about them, but also about all of us. It goes back to what I said at the very, very beginning. What kind of a world do we want to leave when our journeys are complete here? We're all here for a short period of time. We dream of leaving a world where we don't have to worry about guns and gun violence. And at least that our kids don't have to worry about it. You know, I recall the phrase by John F. Kennedy. Many of you remember this, was said, we're going to the moon, not because it's easy, but because it's hard. This is hard, but this is right. This is about continually making a positive difference, as I believe we all have, but about creating a better world for those who come behind. The people on the other side will eventually lose. Will take time, but dedication, perseverance, commitment, resilience, grit, never stopping. That's will win. So as we go through the meetings today, let's appreciate what each of us are doing, inspire one another to do more, to raise the bar even higher than we ever think is possible. Let's leave here at the end of the day wanting, desiring, and committing to do more than we did yesterday. Our communities depend upon it. I thank you, and I'd like now to turn the program over to the MC for the day, Jose Prince. Thank you very much.